You and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. I am your host, Louise Gomez. You can reach us at 954-717-7027. I am delighted to introduce everybody tonight, this evening, to Dr. Christine Schiller, DNP. She is at the Healthy Living Medical Clinic, and the phone number is 772-485-2970. They're right here in Jupiter. The address is 600 Heritage Drive, Suite 210, Jupiter, Florida, 33458. And you can certainly go on their website, www.healthylivingmedicalclinic.com. And you can also email them, healthylivings, as in South Florida, SFL, @yahoo.com. Welcome to the show, Dr. Schiller. How are you today?
Good. How are you?
I am doing well. Thank you so much for taking time out of your busy schedule to come on to the show, You and Your Doctor, so we can learn about all that you have to offer. So I'm excited to delve into this conversation. Can you give us a little bit about your background and your history and what made you want to go down the path that you've decided to journey on to become a DNP?
So I started my career down in South Florida. I started in pediatrics. So I actually did pediatrics, pediatric hematology, oncology, trauma, and all of that. And then I moved up to Palm Beach County and realized I wanted to go back to school to finish my nurse practitioner degree. So I realized I had never actually touched an adult. So I went and worked in some local ERs and urgent cares, then graduated and worked in private practice in Jupiter for about 10 years. And while I was there, I've always been an educator, a professor. I've always taken on graduate students, and a lot of those students encouraged me to go back to school for my doctorate, which I did.
Nice.
And I also use that to teach and to just use in my everyday practice.
Nice. And I like how you started in one position and so you went on to another. So it's you're very well rounded. You have a lot of experience with so many different people. So that's really, good to see that and it shows me that you're also open to learning, right? And wanting to
Yes,
to
lifelong learner.
yeah, lifelong learner. And that to me, being curious and wanting to learn, is intriguing to me because it really shows me that you're always wanting to learn and to study more. And so let's dive a little bit into your practice. What can you tell us? What are your hours? Let's get into the mechanics of that. What are your hours at the practice?
So currently in Jupiter, I am there every Tuesday and Wednesday,
Okay.
about 9 to 6. So Tuesday, Wednesday, and Friday. I do have some patients that I'll see Monday or Thursday evenings, but primarily they're Tuesday, Wednesday, and Friday.
Okay. So they'll have to call and make an appointment first. And
Correct.
okay, I'm going to give you the number again in case anyone's listening. It's 772-485-2970. And so, Dr. Schiller, why would someone like me, I'm in my 50s, why would someone like me decide that it's time to break the paradigm and maybe try something different and go to see you? What are you offering at your practice? Like what type of labs, and how are you doing things a little different?
I think that, my specialty really, when I was in private practice, I actually took over the practice of a woman who only saw women. And they had
Okay.
a lot of hormonal issues, perimenopause, menopause, PCOS, just
Mm,
a lot of different things. And, a few of them said to me, I want to replace my hormones with hormones. I don't want to replace my hormones with antidepressants or
right.
sleep medications. And as I always say, people have a hormone deficiency, not a, different medication deficiency. So, recognizing that those women, and also men, because men go through changes
Sure.
also as they age, um, I just started on a different journey with them and to look at things more holistically.
Mm-hmm.
And I studied functional medicine and hormone replacement and obesity management and just different alternative ways to treat your health care. So I always like to say that I focus more on prevention. I think that in the US, we just focus when we have the disease instead of preventing the disease.
Right.
So find that people that come to see me, number one, for hormone replacement, for testosterone replacement, for obesity management, but really, our healthcare system has changed significantly. I'm sure that we are all seeing that, especially with the influx of patients in South Florida,
Yes.
people who are already existing here or people who just moved here can't find a primary or they
Right.
can't find some hormone replacement and they have to wait a long time. And, nothing against those providers, but sometimes they'll get
Sure.
into it with a provider and, they waited 6 months to get in with them and
Right.
they aren't given the time that they really, need to be with that provider. So I really take the time to sit down, listen to
Yes.
everything, treat you as a whole person, not as your diagnoses.
Right.
So that was kind of a long answer to your question,
No,
but
I
I would say
love
the
it.
people
Yeah.
that come to see me, I work with them. I don't say you have hypertension, you take this medication. I say you have hypertension.
Right.
How would you like to treat it? Do you want to prevent it, or
Mm-hmm.
do you want to take medication for it? So I
Right.
think that's why people come to see me.
I really want to also differentiate. So when you say hormones, you're doing bioidentical hormones. Is that correct?
Bioidentical hormone replacement.
Okay. So
So
it's really important people understand me. I will be very candid with everybody. I have been on bioidentical hormones for 8 years now, and it's changed my life tremendously. And so for me, I'm a big advocate of bioidentical hormones. And I try to educate people in the sense where if they ask me, some people may say, oh, well, I heard hormone replacement therapy, that study that they did, back, I don't know how many years ago, that tarnished the whole idea of thinking, hormones were bad and whatnot. But for me, myself personally, I've seen a tremendous improvement in my day to day and my health and my biomarkers. So, like somebody who's listening right now, because we do have the demographic listening that may be wondering, like, I'll give you my example. I had migraine headaches, and had I gone to a regular doctor, I think they were trying to give me regular migraine medicine. I said, no, I got to go deeper than this. So I went to the right doctor and realized, no, my progesterone was so low that I was getting migraine headaches certain times of the month, and it was so bad for 4-day migraines. So I agree with you, and I love how you put it. You said, do you want to treat your XYZ with the medication, or do you want to learn how to prevent it? And so really that's what we're talking about here. We're talking about getting to the root cause of the challenge. So I'm so grateful to have this platform to speak to doctors like yourself, to be able to educate people and really let them know, there are other options. We can, if we're open to looking and learning, there could be things that we can, learn that's outside of the maybe traditional scope of things. I also wanted to ask you, what about like labs and blood work? What are you looking for when you're doing labs that are different than what a regular, let's say, traditional primary care would be looking at?
So when usually when you go for your, yearly physical, you'll get your standard, um, cholesterol panel, your CBC, which tells us your white count if you have an infection. You also get what's called a CMP, which will show, your sugar levels, things like that.
Right.
Sometimes they will add in just a TSH, which looks at your thyroid and your urinalysis. Now, I, being more in prevention, I'm going to also look at something called your hemoglobin A1C,
Mm.
which that's a big talk right now. Hemoglobin A1C can tell me what your blood sugar has been for the past 3 months. So, as we all know, unfortunately, I have a lot of patients that will say to me, I'm pre-diabetic, and I'm like, well, most of the world, most of the U.S. is pre-diabetic, so we have to focus. So let's focus on preventing it before you get, so an A1C around 5.5, 5.7 is good, but once you get to 6, you're considered a diabetic. So those are the things I look at. I look at your iron stores. I look at, when I do your hormone panel, your estrogens, your progesterone, your testosterone, your DHEA, even doing a thyroid panel, even people who have something called Hashimoto's, they have TPO antibodies. So to get into a big lab discussion, I tell patients that if I code your labs properly, they will get paid for by your insurance company. So I know that a lot of times, patients are told, well, it's not necessary to order that, or your insurance won't pay for it. But if it's coded correctly, your insurance will pay for it. And, women assume just when you turn 51, that's the average age for a menopause.
Right.
But you could be like yourself. You could be suffering, from mood disorders, from insomnia, migraines, way before you are officially in menopause. So those things, even just for patients to be able to look at their labs and for me to go over it and say, this needs to be addressed, this needs to be addressed, or this is okay. Just that conversation is very reassuring to patients that, okay, well, we have a good look here of everything and my concerns are being met.
I like that because I feel like going to the type of doctor and the services that you offer, it's definitely more of getting to the root of it. I'm gonna have to change my mind. It's definitely getting to the root of the issue, and that's what people want. People want to know that they're talking to the doctor that really is wanting to be on that same journey with them and really wanting to get to the root cause of whatever that challenge is. I also
Yeah.
wanted to discuss peptides. That's like the hot topic lately, right?
Right.
Tell us about peptides, because I've been hearing a lot of more friends now asking me and talking. Actually, we have a quick commercial break. When we come back, we're going to talk everything peptides. So we'll be right back, Dr. Schiller. Okay. Give us.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, everybody. Welcome back to You and Your Doctor. I am having such an informative conversation with Dr. Christine Schiller. She is right here at the Healthy Living Medical Clinic. The phone number is 772-485-2970. She's at 600 Heritage Drive, Suite 210, Jupiter, Florida, 33458, and that's healthylivingmedicalclinic.com. Thank you for coming back, Dr. Schiller. I am so intrigued to learn about peptides because it seems to be the buzz lately. People are wanting to talk peptides, and I know even some of my friends now are asking me, what do you know about peptides? So I always like to inform everybody. So, what are peptides? Who should be taking what? How do we know? And, what's going on with the latest in peptide therapy?
So I'll go over the two biggest peptides that we're talking about right now in the news. And I'll go back to what I said a few minutes ago about how most of the U.S. is pre-diabetic. So
Yes.
One in every two people are pre-diabetic. And we know that your insulin levels, for years they can be high until you really realize it. So, your insulin levels, which is, glucose, which is carbohydrates, which is just really processed foods that aren't good for all of us, but we all really have that kind of diet, that increases your insulin level. Insulin levels have been proven, unfortunately, to accelerate dementia and
Yes.
Alzheimer's and memory. I'm just putting it out there that, a lot of people, and there is studies that associate high sugar levels or insulin levels with cancer also.
Yes.
So it's really important that we get these levels down. Now, there are these peptides that are called GLP-1 agonists that have actually been around a very long time in oral pills. And they have been marketed by pharmaceutical companies. And a few years ago, they came out with injectable peptides. The pharmaceutical brands would be Ozempic. The generic name is semaglutide. So we found as providers that insulin levels and sugar levels went down really nicely, really fast with these injectables. So for people with type 2 diabetes, and I'm talking, type 2 diabetes, we cause it ourselves.
Right.
We eat poorly. It's not type 1. Type 1 is genetic. So we're talking mostly adults, type 2. The pharmaceutical company did more studies and realized if they increased the levels or the amount you injected, people lost weight at a really nice pace. Mm-hmm. So then we realized, okay, this brand of peptides isn't only good for type 2 diabetics, it's also people who are obese, overweight. It's now being indicated for people who have had a recent heart attack because it's showing cardiovascular benefit. So the drug has many benefits. Mm-hmm. A lot of, I just mentioned, a lot of times we're using it as something called off-label initially, meaning there are studies being done right now with these peptides that even if you take them in micro doses,
Right.
it is helping prevent Alzheimer's and dementia and memory loss.
Wow.
So mostly, and your friends may be using it for weight loss.
Right.
I do find that especially with my menopausal women,
Mm-hmm.
they have always been exercising. They have always been eating right.
Sure.
But they are having a very hard time getting off that belly fat, which we call the adipose tissue around their stomach. Mm-hmm. And these injectable weight loss drugs have been doing a very nice job of allowing them to take off that extra weight at a nice pace, and they're very healthy with it. So
Nice.
it's being used for a lot of things, but those are the two biggest things. You'll know them as Ozempic and Wegovy, other brand names,
Right.
and then you also have Mounjaro and Zepbound, which are the other, which is tirzepatide. And go ahead.
I like how you mentioned how microdosing can be the beneficial as well. Doing them, maybe people don't need to lose that much weight, and they're microdosing it at a much smaller rate, and they're still getting benefits.
Well, they're getting benefits, and it's even though I don't always recommend it because some people don't do well with the paleo diet or keto diet.
Sure.
A lot of them say that they feel like their brain function is very clear. They feel very clear not eating carbohydrates and sugars. So this will kind of do the same thing. People have told me, and they're seeing in this research that
Right.
People are able to have better brain function, to have better memory and
Right.
recall. So
Makes
not
sense.
only long-term recall, but short-term recall. And even going back to women, we're getting it all, right?
Yeah.
We're doing a lot of studies where once you go through menopause, you're not making the stem cells; they're turning more into adipose cells, which are fat cells. So it is harder for women to take off that weight
Sure.
once they get to menopause, and it's very upsetting to them because
Of course.
they say I've always been at a good weight, and I woke up one day and there's a tire around my waist.
Right.
So
Of course.
I found microdosing it with these particular patients, male and female, they're able to get to their goal weight, and they're very happy about it. They feel good about themselves.
Sure.
That's important. That's the one thing about getting healthy. It's not about losing weight and people complimenting you. It's
Right.
about I
Feeling
feel
good.
healthier because
Right.
even with COVID, a lot of us work remotely.
I do. Yes.
So,
Hmm.
so now sitting is like smoking.
Yes, I heard that with the last doctor. I said that too. Sitting is the new smoking.
Sitting
Yeah.
is a new smoking. So,
Right.
we have to find ways
Right.
to energize ourselves and get up and move around
Sure.
because that's all about, longevity and preventing. And we are all living a very long time.
Right.
It used to, one day I worked, I think that I only had one patient under 65. Everybody else was above 65.
Wow.
Years
Amazing.
ago. So I tell patients, we all want to live long and healthy.
Right. Quality of life.
Quality of life is very important. And if we
Absolutely.
don't start that now, we can make, I always say, I can make you live as long as you want on medication, but do you want to go that route?
Right.
Yeah.
Dr. Schiller, tell us what else are you doing at the clinic? What other types of treatments that people may be looking for that you're offering at the clinic besides the peptides and the bioidenticals?
So I do peptides, I do bioidenticals, I do some primary care,
Nice.
like I said, for patients who can't get in with, PCP.
Mm-hmm.
Many years ago, I had some colleagues of mine that I work with that actually asked me to go back and learn how to do injectables. So I've been doing injectable Botox, hyaluronic acid, fillers for probably over 10 years. So I also do some facial aesthetics.
Oh, okay. So kind of one-stop shop. That's good. You can get
One stuff I do infants to geriatrics and everything in between. So
that is amazing. And so what are you finding is the experience that people are having? Because I feel that more and more people are open to trying to doing just besides the traditional doctor and maybe doing bioidenticals. What has been your response at, let's say, the people at the Healthy Medical Clinic? What are they saying about their results, and are they referring people? What are they saying about their experience?
So I would say that overall, patients come to me because I listen to them, I listen to their concerns. And just like you mentioned with the hormone replacement, when I started studying that, and I studied it for a year before, I had a few patients that were
Right.
kind of my guinea pigs. So we
Yes.
studied it for a year. And, once other people in the community saw how
Right.
happy my patients were, they're
Right.
like, what is she doing over there? And I always say, I never gave anybody Lipitor and they told 20 patients.
Wow.
So with hormone therapy and weight loss, they're
Yes.
just happy that even if we don't, they decide not to treat, they at least have an answer and they have somebody who's listening to their concerns, validating their concerns,
Yes.
and giving them an option whichever way they decide to go.
So important. Dr. Schiller, we actually have 1 minute left. This time has flown by so quickly. But in the last minute, any takeaways? Is there anything that you'd like to leave the audience with to keep us a little more informed?
I just tell people to always keep yourself informed, always be up to date
Yes.
on your health care, especially for people before you get insurance or buy an insurance plan, make sure you consult somebody, and just if you're looking for either a provider, ask your neighbors, ask your friends, ask the people you meet at pickleball.
Yes.
That's how you meet good providers and you network. And
Sure.
and I always tell people, because I've done everything in life, I say, I've worked from Miami to Vera, and I know
Nice.
people all over the country. So I tell people, even if I can't help you, I'm pretty good at finding that person who can help you.
I love that. Thank you so much for doing that, because that really makes us feel that we can be confident in you, that you'll be able to refer us to others. So I want to say thank you so much for coming in tonight, Dr. Schiller. It's been a pleasure. Again, anybody wants to reach her, the number is 772-485-2970, Healthy Living Medical Clinic. Thank you so much. It's been an absolute pleasure. Have a wonderful evening.
Have a
And
great night.
take care. Bye.
All right, thanks.
Thank you for letting us share with you